Well, the CDC has issued a nationwide health alert asking doctors to be on the lookout for children with severe liver inflammation or hepatitis in healthy children. This comes after 9 young kids in Alabama have been sickened, some severely, with an unusual form of hepatitis. 2 additional cases have been reported in North Carolina. The Fox Medical Team's Beth Galvin shares what we need to know about a cluster of cases in Alabama.
Alabama public health officials say they were notified back in October about these rare cases of liver inflammation in children that seem to be combined with another type of gastrointestinal virus. They haven't had a new case since February, but the CDC is alerting doctors to be on the lookout for unusual hepatitis in young children to make sure they're not missing cases.
Children's hospitals can sometimes see some pretty unusual illnesses. And last fall, Dr. Wes Stubblefield, district medical officer with the Alabama Department of Public Health, says they got a call from the CDC about a strange cluster of 9 children between the ages of 1 through 6 sickened at local hospitals with a combination of hepatitis or liver inflammation and a common gastrointestinal virus known as adenovirus type 41.
All 9 of the children in Alabama that presented with hepatitis were all positive for adenovirus. 5 of the 9 were positive for adenovirus type 41. The other 4 children's adenovirus couldn't be typed because there wasn't enough in the sample for it to go through the typing process.
2 of the children became so sick their livers failed and they needed a liver transplant. But Dr. Stubblefield says what's odd is an adenovirus infection doesn't usually damage the liver.
It's mostly associated with mild to moderate gastrointestinal disease. Adenovirus has many different types, and it can range anywhere from pink eye to cold symptoms to nausea, vomiting, diarrhea. The concerning thing in this case, of course, is that this virus, not really known to be something that causes significant hepatic injury, caused a very, very serious hepatitis in these children, and especially those 2.
Something else unusual?
All of these children were otherwise healthy children with no significant underlying medical conditions. And the other thing is that none of these children really have any relationship to each other or any links to each other.
The CDC is alerting doctors across the country to be on the lookout for children with unexplained liver inflammation. And signs of hepatitis can include fever, fatigue, loss of appetite, nausea and vomiting. And kids may also have abdominal pain, dark urine, light-colored stools, joint pain, and jaundice, or yellowing of the eyes and skin.
If they get to the point where they see some of these other things, or if they just seem to be sicker than they would expect, or they think they're getting dehydrated, or they can't wake them up, obviously they need to go and have a consultation with their physician.
And Dr. Stubblefield says there's no apparent link to COVID-19.
My understanding is that none of these children had recent COVID, had COVID at the same time as this, and none of them had had vaccinations for COVID.
2 additional cases of hepatitis have been reported in children in North Carolina. Both of them recovered. And the World Health Organization says 12 countries are now reporting a total of 169 cases of this unusual hepatitis in children. 17 of those kids needed a liver transplant. 1 of them died. For your Fox Medical Team, I'm Beth Galvin.